Cost effectiveness is not only based on I need a certain result, keep in mind the whole process. For example, you get a patient in the emergency department who was admitted from another intensive care unit. He's highly at risk to have MRSA, for example. You have two choices. They didn't do an MRSA screen in the other hospital. You do culture-based screening, you wait 48 hours. If you're lucky, you wait 24 hours. What do you do in between? If you do a PCR right away, you have your result before the patient leaves the emergency department. So of course, the costs for the MRSA PCR are 5 times higher or 6 times higher than the culture. But the whole management of this, for the whole length of the hospital stay, changes at this moment.
My personal belief is that quality is quality from both a patient outcome standpoint and from an economic standpoint. You can impair your quality by not having a good test, and so it's better to pay a little bit more for a test that gives the right answer than to pay less for tests that don't give good answers.
Well, I suppose the two things are cost and cost effectiveness for hospital-acquired infection, STIs, respiratory, GI, meningitis. The cost is often quite separate from the patient management issue. And if the benefits are seen at the patient side and the cost is seen at the laboratory side, then you can see there's a disharmony. In bringing those two things back together is a crucial component to introducing cost-effective measures.
Doing the best test right at the beginning, it does two things for you. One, it gives you a rapid answer as to who needs to be in isolation. And for us, that's saved a lot of extra isolation that's not necessary. If you have a rapid test, you can eliminate 85% of the isolation, which is a huge reduction in expense, both in time of healthcare personnel putting on and taking off gowns and gloves.
The most improvement for STIs, I think, is rapid testing. As it is now, if they have any symptoms of an STI, they get treated. So there's a good deal of over-treatment, and so you could tailor treatment more specifically or not give treatment. And this is a very important reason for antibiotic stewardship, so that you're not over-treating and misusing antibiotics when there's no protection.
Molecular testing has had a massive impact on patient management. The patients get a diagnosis very quickly, that typing is straightforward, and that with that information we can actually counsel and get patients onto therapy if necessary much quicker.